It was a Sunday afternoon. Tandy was making lunch in the kitchen while her 2-year-old son was playing with blocks on the floor. She glanced over, and suddenly his body had gone still. His eyes rolled backwards, his little body started to jerk, and she heard a sound that she'd never heard from him before. She froze, just for a second, and then screamed for her husband. The whole episode probably lasted about 2 minutes, but to Tandy, it felt like hours. She told me she thought he was dying. If you've ever seen your child have a seizure, even once, you'll know that heart in your throat, ice down your back kind of feeling. Your brain goes into overdrive. Is he choking? Will he survive? Do I need to put something in his mouth? Spoiler alert, you don't. Today, we'll be talking about what parents should know about seizures in their children, from the harmless and common to the rare but serious. We'll talk about what to look for, when to worry, and what you should and shouldn't do in the moment. And hopefully, by the end of this episode, you'll go from deer in the headlights to the calm parent that knows exactly what to do. So what exactly is a seizure? A seizure happens when there's abnormal electrical activity in the brain. Think of your brain as a high-tech electrical circuit. When there's a short circuit, that's when a seizure happens. Depending on where in the brain it starts, seizures can look very different. We have 3 major types. Generalized tonic-clonic seizures occur where the whole body stiffens and jerks. Absent seizures happen where the child stays blankly for a few seconds and can often be mistaken for daydreaming. And focal seizures, which only affect one area, like an arm, a leg, or part of the face. Not everything that looks like a seizure actually is. Fainting, breath-holding spells, migraines, and even intense daydreaming can mimic some seizure behavior. So why do seizures happen? In infants and toddlers, febrile seizures are very common. These occur in the presence of a fever between the ages of 6 months and 5 years. Infections like meningitis and encephalitis can cause seizures as well as electrolyte levels like low calcium, low sugar, and low sodium. Another cause is rare brain malformations and genetic problems. In school children, it's important to consider things like epilepsy, head injuries, and even certain genetic and metabolic conditions. In teenagers and older children, causes of seizures include epilepsy, sports-induced head trauma, substance use, and sleep deprivation. Yes, missing sleep can cause seizures. Let's talk about febrile seizures, the common but scary kind. About 1 in 20 children is going to have a febrile seizure at some point in their lives. It's not about how high the fever goes, more about how rapidly it rises. Simple febrile seizures last less than 15 minutes, affect the whole body, and only happen once in 24 hours. Complex febrile seizures last longer, affect only one part of the body, and can occur more than once in 24 hours. The good news, most children outgrow them by age 5 to 6. The bad news, they can be extremely dramatic and frightening in the moment, even when harmless. Let's move on to non-epileptic seizure-like events. Some episodes may look like seizures, but are not caused by abnormal electrical brain activity. These include breath-holding spells. Usually after intense crying or being startled, the child may briefly pass out and jerk or twitch. Syncope or fainting, with sudden loss of consciousness from low blood pressure, dehydration, or standing too long, sometimes with a brief twitch. Shuddering attacks, quick tremors, often during feeding or excitement. Or night terrors, where your child may scream, thrash, or look possessed, but is completely asleep and has no memory of it afterwards. Knowing the difference between true seizure forms and non-epileptic seizure-like events is important because the urgency and the treatment are different. Always ask your healthcare provider to help you figure it out. What to do in the moment. Do stay calm, or at least pretend to look calm. Gently lay them on their side to keep the airway clear. Loosen tight clothing. Move objects that could injure them away, and time the seizure if possible. Don't put anything in their mouth. Don't try to hold them down. And don't offer them something to eat or drink until they are fully alert. Do call an ambulance if your child is very young and this is their first seizure, if the seizure lasts more than 5 minutes, if they fail to wake up or breathe normally in between, if another seizure starts straight after, or if they've sustained any injuries during the seizure event. So when do you worry, and what happens next? After a first seizure, your child will need blood tests, an EEG, and a scan. Some kids will be diagnosed with epilepsy and need daily medication. With these kids, the aim is to keep them seizure-free so they can live a normal, happy, active life. For other kids, this is a one-time event, and then the decision is made to monitor them and observe for further seizures. Now, let's bust some myths. Myth: they can swallow their tongue. Fact: they can't. Myth: you should put a spoon in their mouth. Fact: please don't. Myth: all seizures mean epilepsy. Fact: nope, sometimes it's a once-off event. Watching your child have a seizure can feel like the longest, scariest moment of your life. But knowing what to do in that moment can turn panic into calm, confident action. And that's what you need in that moment. I want to hear from you. If you liked this episode, feel free to like, share, or drop a question in the comment box. And remember, stay kind and stay curious.